This is the Ohio Farm Bureau podcast. Thanks for watching, listening, wherever you might be. I'm Ty Higgins. From weather to higher input costs, lower income, long hours, the weight of keeping the family farm in business, a lot of incredible amounts of stress that can take a toll on a farmer's mental well-being. A newly created alliance will focus on mental health in agriculture to ensure Ohio's farmers, farm families, and communities are better equipped to deal with stress. Dr. Dee Jepson joins us, professor of the Department of Food, Agricultural, and Biological Engineering, and also the state leader for OSU Extension's Agricultural Safety and Health Program. Dee, always great to see you. Welcome to the podcast.
Thank you. Great to be here and talking about this topic too.
Yeah, a topic that's not new to agriculture, farm stress, but it seems that when we had 2019, that incredibly wet spring where 1.5 million acres of corn and soybeans didn't get planted, the topic started to get a little bit more attention. And do you feel that we're maybe bringing mental wellness to the forefront now than we ever have?
Well, maybe not always in farming, but I see a lot of ads out on TV. I see other people talking about stress. So I think it's just natural that maybe we as the farm community start recognizing the stress and you know, even our children and those in high school, if I think about when we first used the word stress in my era, like as I was growing up, I didn't use that word. Um, but now I hear teenagers saying they're stressed. I hear, um, you name it. It doesn't matter what occupation you're in. I think everybody's feeling stress. So I think it's okay that we start talking about stress on the farm. How about that?
I like it. Now, I said it was nothing new. I grew up in the 80s on a dairy farm, so I know farm stress. I know what it can do to a farm family. But it was talked about in whispers back then, right? It was always just around the kitchen table or maybe just in passing. We talked about what the farmer down the road might be dealing with or unfortunate loss of life due to farm stress back during the crisis of the mid 80s. That's what I grew up in. Um, there was a huge stigma there in the 80s. There's always been a huge stigma with mental health and farm stress. Do you think with the more we talk about it these days that we're breaking through that stigma a little bit?
I hope so. I can't speak for everyone, but I do think the more that we talk about it, it makes it more normal that we don't feel alone. Some of the pressures that farmers feel are no different than what other farmers might feel, but until they talk about it or understand, because from the outside looking in on a property, on an operation, on a family, it's really difficult to know what stresses they have. And like you said, there's stresses of the season, there's stresses of economics, but farmers are just so resilient, or they find ways that they can work through that resiliency or those stress patterns. So I think the more we talk about it, the more we have options for them to find, and we have different tools in our toolbox. Maybe we can start breaking on down that stigma a little bit more.
Where has it been woven into what you do? I mentioned that you lead the safety aspect for OSU Extension. Where does farm stress fit into that now compared to where it did maybe 10 years ago?
Well, so I grew up in the 80s, let's just say that, right? And so farm stress has been around, but you're right. 10 years ago, we were not maybe talking about it, but farm stress falls in the health side of my agricultural safety and health program, just right where we would put respiratory protection, wearing PPE. We've got to take care of our bodies and our minds so that we can be resilient and we can still be there the next seasons to take care of our farming. So I just look at it as we talk about keeping hot foods hot and cold foods cold when you're out in the field and you pack a lunchbox. Well, what do you pack for your mental health? And how do you think about how are you going to weave in maybe just a little extra time for yourself? Everybody de-stresses in different ways. And I can tell you, maybe you go on a nature walk, or maybe you go out and you scout your fields. Maybe that's the way that we build in our mental health time, or we take a lunch break and just sit there and take it all in, or get caught up on maybe some of our emails or some of our other correspondence if that was stressing us out. So I think it's just a management factor, and it's being aware, just like we're aware of eating healthy, getting good sleep each night. Let's just think about wellness as one of those health pieces that we take care of.
You and your colleagues at Ohio State, along with us at Ohio Farm Bureau, the Ohio Department of Agriculture, Ohio Department of Health, Department of Mental Health and Addiction Services, Ohio Suicide Prevention Foundation, Farm Credit Mid-America. I don't want to leave anybody out. Ohio Corn and Wheat, Ohio Agribusiness, Ag Credit. We're all part of what's called the Ohio Agriculture Mental Health Alliance. It is quite an eclectic group. Why is it so important to have all these different types of organizations at the same table to tackle the farm stress challenges we're seeing?
Well, we're all at the same table, aren't we? And the agriculture table sometimes looks a little bit different than the other organizations. So as there's resources out there that sometimes we don't even know about in agriculture. So if we can tap into some of the resources that the other agencies have, put that the Ohio and the agriculture spin to it, then we can get some more resources out to our farming community. I know a lot of people say nobody understands what I'm going through. I could go see a counselor or I could go pick up a pamphlet, but that's not going to do me a bit of good. And they might be right. And so how do we help the folks that are putting those resources together, the folks that are offering counseling services? How do we help them understand the true stresses that farmers are going into? Telling a person, I'll pull your boots, what is that? Pull up your bootstraps and, shake it off. Or have you thought about a different job? Well, no, those are not options in agriculture. So how do we help kind of everybody understand ag? And then they're helping us understand some of the other resources that we didn't even know were available. And some of the incentives that some of our companies are offering workers for their mental wellness, just like health insurance. And so these are all new terms as we learn together. So having everybody involved at the table, I think it just shows just a great practice.
One of the first real lines of business for this Ohio Agriculture Mental Health Alliance is finding out what's happening across rural Ohio when it comes to mental wellness. You and your team were a huge part of putting together a survey that's out now to give us some answers when that data is compiled. It is a confidential survey. I want you to tell us more about the survey itself, some of the questions that are in it, and why it's so important for everyone to take part in it.
So here we are talking about stress when, Ty, you and I may not really know what the farmers are feeling. So how do we know unless we ask? So I hate asking surveys. I hate asking people to tell us how they feel. But if they don't, we can't move the needle. We can't provide what is needed. I know right now we have a governor that is very interested in mental wellness and well-being, and he would love to find a way to help farmers break down some of those stigmas. So until we can report like what we truly need, do we need more after-hour health care in the community? Do we need more daycares? Do farmers need more support services? Do we need lower prices? Like, we're asking these kind of questions on a survey. One of my favorite one too is, do you feel you get enough time off? Ooh, some farmers would stress just saying it's too stressful to take time off. So I don't want to take any time off. I'm perfectly fine. So we're asking questions that really get to the heart of, what drives their lifestyle. What are the most stressful situations? Is it the prices that they receive for their commodities? Is this the cost of farm inputs? Is it access to the markets? Is it a labor shortage? So we're not just asking, I guess we're kind of asking management and farm management kind of questions, not those touchy-feely questions that people like, oh, I don't want to tell you how I feel. Well, tell us how you're stressed, or tell us how some of these outward community and economic and the weather, how does all of this really affect you? Because if you don't tell us, we won't know. Um, and then there are some other questions on there about, have you sought a counselor before? Well, yes or no. This survey is completely anonymous. We don't ask your name. We don't ask your location. Um, there's no way for us to ever find how you have told us about your stress. We would like any agricultural person, agricultural worker, agricultural family member, if you're over 18, to log in and tell us what's stressing you out, because we know it's probably different for different generations, for different places where they are in their life. Are they just getting started? Are they long time seasoned? Are they looking at retirement and worrying about the future? What is on our Ohio farmers and farm families' minds? It will take a few minutes to answer our questions. I'm not going to candy coat that. It'll probably take you 10 minutes to sit there and actually think and click through some of those thoughts. But I will say that a few farmers have let me know that they've taken the survey, and you know what? It wasn't all that bad. And I said, I'm so glad to hear you tell me that. And so when they said, yeah, we thought it would be a lot harder than this. And I said, no, just let us know some of the high level aspects of what's keeping you up at night, or what's causing you some concern for the future.
The survey is open now, going to be open through the majority of the summer. Really easy to find. We'll put the link to the survey itself in the description of this podcast. You can always go to ohiofarmbureau.org and search Farm Stress Survey to find the details there as well. So, Dr. Jepson, once we get the data, once the survey closes out and we go over everything that farmers across Ohio and agriculturalists across the state are telling us, how do we use that data to move this mental health conversation forward?
Well, you're right. That's the next step. So once we learn, I think we just have to take it from there. I don't want to guess what's in some of these responses. We've had hundreds of people already reply. And so if we can get a few hundred more, that just helps us to know, do we need more support? Maybe it's farm management training programs, learning how to balance the books. Is it succession planning? Is it family communications and lifestyle support? What resources does Ohio State University, does Ohio Farm Bureau, Department of Agriculture, how do we then meet the needs of what's being told to us about some of these issues that are affecting the farm? Can it bring more services to our area, especially in the rural areas? I hope so. But until we know what we need and the pockets that, maybe we're missing some information, maybe there aren't services in some areas as readily as if you live near a larger city. So some of these questions, I think, will help drive where we go. And then we'll go out and have fun putting those outreach programs together. And maybe even additional services, like I said earlier. Again, the whole point is to be there for the farmer and their families for what they might tell us they need.
Dr. Dee Jepson is professor at the Department of Food, Agricultural, and Biological Engineering at The Ohio State University. Also serves as state leader for OSU Extension's Agricultural Safety and Health Program. Been a pleasure working with you as part of this alliance, the Ohio Agriculture Mental Health Alliance. I can't thank you enough for the hours that you and your team have put in to get this survey off the ground, and all the great work that we're going to do collaboratively after we get the results to, as you mentioned, help every single farmer across Ohio find the resources that he or she needs as they face challenges in this very difficult industry. Dee, thank you so much.
Thank you.
Find out how Nationwide Agribusiness can help you grow your business. Get to know the people with the experience and knowledge to help you. Whether you are looking to protect your farm or ranch from the ground up, or need someone who understands your changing commercial ag needs. Find out how to better manage the risks of your ag business, or how quickly you can get back to business. Learn how you can protect your next with Nationwide on your side.
Who feeds your need for new ideas for your family's best farm future? Ohio Farm Bureau. We work with our members to shape ag policy that will positively impact our industry. Farm Bureau is advancing business solutions to give you a competitive advantage. We help you gather information to stay ahead of important topics and technologies. Plus, Ohio Farm Bureau creates opportunities for growth. Ohio Farm Bureau, feeding your need for new ideas.
Welcome back to the Ohio Farm Bureau podcast. I'm Ty Higgins. Suicide is the second leading cause of death among young people, and every year in the U.S., more people die by suicide than in car accidents. The suicide prevention hotline, created back in 2005, got a bit of an upgrade a couple of years ago. Now referred to as the Suicide and Crisis Lifeline, can be accessed as easily as dialing or texting 988 from any phone. Want to talk about that new resource and how people are utilizing it in Ohio and across the country with Doug Jackson. He is the 988 administrator through the Ohio Department of Mental Health and Addiction Services. Doug, thank you so much for taking time to be on the podcast, and it's great to see you.
Hi, thanks for having us. This is a group of people that we want to be talking with. Suicide is not uncommon across any demographic in Ohio, but even in the farm community, we know that this is something that needs to be talked about, mental health in general, not just suicide. So I'm looking forward to the conversation with you and being a part of what your audience is hearing.
I mentioned the shine that this got a couple of years ago in 2022, kind of a rebrand and a rethought about people wanting to reach out to professionals on the other end of the line and talk about what they might be going through. Tell us about 988 and what's the core of it.
Yeah, well, 988 was designated as the 3-digit call number because nationwide, there needed to be a number that was easy to remember. In a time of crisis, just like in a physical health emergency, you don't have to think about after a car accident, what 3-digit number do I call? 911's the number, and you're going to get police, fire, ambulance. Well, we wanted it to be that simple. And so this was a national act that allowed mental health services to be available to those who are in crisis. And crisis has a very broad definition. It's really defined by the person. So we wanted it to be available when people just needed somebody to talk to. It doesn't have to be about suicide. It's mental health in general.
How effective has this been? Now that it's easier to reach out and it just has 3 digits, which was the main reason for the changes to make it a little bit more accessible for Americans, and how is it being utilized here in Ohio?
Yeah, we keep seeing month after month an increase in the number of contacts that Ohio is getting in 988. So we have 19 call centers throughout the state of Ohio who are responding to those contacts. It's both calls, chats, and texts that people can reach out and contact 988. That way it's available through whatever mode of communication you prefer. But every single month, Ty, we're seeing an addition to the number of calls that we're getting. Calendar year 2023, we saw over 163,000 contacts to 988 by Ohioans that were responded to out of our 19 call centers.
You mentioned 19 call centers across the state, and one might think if this is a nationwide initiative and there's one number that would just go to one call center that's maybe set up in a big city or a certain part of the country, why is it important to have those different call centers? I know that where you are in the country geographically might have different challenges across the country.
Yeah, you think about that on a national scale, but even if we just look at in Ohio, Ohio is diverse. We have metropolitan, we have rural. And 19 call centers allows us to have the most local response to where that person is at. It's not city by city or even county by county, but we feel that 19 has been a good coverage throughout the state to allow you to connect with somebody who understands the culture, the community that you live in, and be able to provide local supports if that's what's needed. So not only is 988 available to talk to somebody on the phone, hopefully be able to help them through that time, but if additional supports are needed in that mental health space, the person you're speaking to at 988 is going to know what available resources are in your community.
Who's on the other end of that line when you call or text?
Yeah, that's a great question because people are oftentimes concerned about who they're talking to. And first, I want to say that it's confidential. Even before I say who's on the other end, when a 988 contact is answered, it is confidential. Who you're speaking to and your own identity is confidential. We're not seeing any sort of background information on you when you call into 988. We're not even seeing your precise location. The routing is used just to get it to the closest call center. So you should feel comfortable calling, but these are trained mental health professionals, hours and hours of training provided. We're talking months before a call taker would be responding independently to an incoming contact to 988. And they are getting types of training, everything from making sure that the person is safe when they call, making sure that they aren't actively going to be taking their life, to, just listening, empathetic listening. Sometimes we just need somebody who is unbiased to listen to what we're going through. And so 988 allows that, where you might not talk to your family or friends about the feelings you have or the issues that you're having, because they're probably going to offer a biased opinion back to you. But 988 is trained to listen and then provide feedback if needed.
How does the texting aspect work?
Yeah, so the three different ways of contacting, it's just like you would text, if you and I were texting, except the number that you're texting to is 988. So in the the two line, so to speak, 988 are the only three numbers that you put into there. When you initiate that and ask for help, it will come up with a short survey to make sure we're getting you to the right place, the right call center. You don't even have to fill out all the information in the survey in order to get a response, but it's a pretty quick turnaround to get somebody live on that chat communication or on that text communication with you. It's not robotic, it's not AI, it's an actual person that's sitting there, a trained mental health professional who's going to engage in that conversation.
What have you seen or heard to be the biggest hurdle for someone that maybe needs to use 988 but just can't get themselves to do it for whatever reason? What are the things that might hold someone back from using this free and confidential resource?
We oftentimes in the mental health space, we talk about the stigma of mental health. And stigma, it's an appropriate word, but I'm going to break it down even a little bit more from there. We get in our own minds sometimes and think, I've got this, I can handle this. And we stay in our own minds, even in that place where we can't handle it. And then those thoughts could be coming into your own mind about, well, the only way to handle that would be to end my life. And when we rely on ourselves and not the input of others or not the mental health professional that can help guide us through talking and processing and seeing if additional resources are needed, it's a dangerous space to be in. So I'd say stigma is one, just we don't want people to think that we've got a problem. And the other is ourselves. We get in our own way.
How much is the 988 campaign, you and I having this conversation, just the outreach efforts, how much does that help really amp up communication to our communities to better understand mental wellness, but also break through that stigma you're talking about?
Yeah, so if you remember back, Ty, 911, the three-digit number for police, fire, ambulance, when that became a number for us to dial, we had to train the community that that was the number to dial because, in that era of life, telephones were connected to the wall with a cord, and that telephone probably had a sticker on it with police, fire, and ambulance, 7-digit telephone numbers. There was a lot of education that happened by public service to make 911 the known number for police, fire, ambulance. We are walking through that same experience with 988. There's been other crisis lines that have existed, other 1-800 numbers, other local numbers, and those have been fantastic resources over the decades of mental health. But now there's a 3-digit, easy to remember number. People need to know that it exists, what it is, if they call it, what they're going to experience. So we're in a period of education right now in our awareness campaign. Our primary goal is for people to know that it's a resource for Ohioans. We did some research. We found that about 1 out of every 3 Ohioans knew that 988 existed. Well, that means 2/3 of the people, if they're experiencing a mental health crisis, don't know who to call. So we are increasing the number of people that are aware of it. We're increasing, once they're aware of it, the number of people who are utilizing it, and hopefully building trust with the community that it is a valuable resource in that time of need.
Do you think having this conversation, even if people haven't heard about 988 or maybe they have, just you and I talking about it, I think kind of breaks through that brick wall that we see when it comes to having these conversations, makes it a little bit more palatable when people hear more and more about it?
Yeah, when you're talking about mental health and you understand that it's okay to not be okay, you start to get a little bit more comfortable when you're the one not feeling okay. You start to normalize that and say, oh, other people have been through this. Other people have called 988. Other people have gotten the help that they need to live another day and to have hope.
I hope that our listeners and viewers have had the chance to utilize this resource if they needed it. And if they haven't heard of it before, maybe they'll think about it as soon as they get done listening to you and I have this conversation. How can people that are watching or listening to this podcast find out more about 988?
Yeah, I mean, through just Google 988, you're going to find a whole lot. I like to say that as a generic answer because sometimes people don't remember a web address, but Ohio is operating our centers in Ohio to respond to Ohioans. You can find out more about 988 in Ohio by going to 988.ohio.gov. A lot of information in there on the trainings that we provide to those contact specialists, the coverage areas of those call centers, and then even marketing material, because some of the people listening might say, hey, I want I want to put this up, in our community or in our Farm Bureau or wherever it's at so that others can become aware of 988. We've got resources there that you can save it, you can print it, you can make sure that others that you know and love are aware of 988.
Mental wellness, such an important topic for Ohio agriculture and really for farmers across the country. We have seen efforts over the last 5 years from the American Farm Bureau Federation, the Ohio Farm Bureau, along with the Ohio Department of Health and your department there, Mental Health and Addiction Services, Ohio Department of Agriculture, all really working to get as much messaging out there as possible to farmers and the rural community across Ohio. So Doug Jackson, I really appreciate what you're doing there with 988 and really helping to give just another tool in the toolbox for people looking for resources for mental wellness. And thank you so much for all the information today.
Ty, thanks for getting this out to the farming community.